Hello, this is Group 4. We're doing our crisis on the opioid crisis. My name is Alicia.
My name's Bianca.
My name is Ernesto.
And my name's Gamaliel.
So the current opioid epidemic is one of the most severe public health crises in the U.S. history, which started in the mid-1990s when the powerful agent OxyContin, promoted by Purdue Pharma, was approved by the FDA, and that triggered the first wave of deaths due to the large amount of prescriptions for this opioid. Then came the second wave of deaths from heroin market that expanded to attract already addicted people, and most recently the third wave of deaths, which comes from fentanyl. Worldwide in 2019, about 600,000 deaths were attributed to drug use. Close to 80% of these deaths are related to opioids, and about 25% of those deaths are caused by opioid overdose. Overprescribing is a major contribution to opioid crisis, and Dr. Ronald Hirsch blames the crisis on physicians as well as the Purdue Pharma. So the WHO, the World Health Organization, supports countries in their efforts to ensure optimal availability for minimizing the overprescribing of the medications. They do recommend as well that naloxone be made available for people who are likely to witness overdose. And they also recommend use of range of treatments for opioid dependence, such as using methadone or the bupropion and treating with the naloxone.
On a national level, the CDC is committed to fighting the opioid overdose epidemic and supporting states and local communities as they battle this issue by monitoring trends to better understand and respond to this epidemic. Additionally, the CDC advances research by collecting and analyzing data on opioid-related overdoses to better identify areas that need assistance to evaluate prevention efforts. Some of the ways the CDC helps states and local communities is by implementing effective strategies in preventing opioid overdose. The CDC does this by supporting states with funding, resources, and information to prevent risk of opioid misuse, overdose, and death, while also ensuring patients have access to safe and effective pain medication. The CDC also works to educate the public and raise awareness about the risks of opioid misuse and abuse by empowering the people to make safer choices. Lastly, the CDC improves patient safety by providing healthcare providers with resources they need to improve opioid prescribing. CDC also offers healthcare systems recommendations and guidance for decision making based on proven practices.
Okay, so one of the barriers that takes away the spotlight from others is that governments and the public have been placing the blame on the overprescription of opioids. This may have been true at first, but the government and medical bodies have addressed the overprescription through improved guidelines, physician education, and vigilant monitoring. Even though prescriptions have reduced from a high of 81.3 per 100 persons in 2012 to 58.5 per 100 persons in 2017, the death rate related to opioids has increased. Another barrier can be attributed to the transition of opioids to heroin use in the USA and Canada. There is evidence from Canada that indicates many individuals acquire heroin or other opioids from the drug market when denied opioids from physicians. Another barrier is the increase in illicitly manufactured opioids such as fentanyl, which contributed to 59% of opioid overdose deaths in 2017. The last barrier I want to talk about includes the stigma of individuals affected seeking treatment. The first mitigator is the implementation of drug checking technologies such as easy-to-use test strips, which can help promote dose reduction or drug disposal. There has also been an effort to scale up opioid agonist treatments, which include methadone and buprenorphine. Another public health approach is replacing the drug supply from the markets to legal opioid alternatives, such as hydromorphone in supervised facilities. The overdose reverse agent naloxone has also been more accessible to users, such as in Canada, naloxone has been available without a prescription. The public health approach has also researched and considered the potent role of social and structural drivers such as mental health problems, suicide, and alcoholism. These consist of communities with a socioeconomic disadvantage.
The public health effort to the opioid crisis was ineffective. The public health approach was more aimed towards utilizing law enforcement and criminalizing those by locking them away in jails and other facilities. The individuals did not have the problem addressed or the disease addressed that they needed help with. Drug misuse was socially stigmatized and harmful reduction strategies were implemented. As a result of these strategies and in a combination of the pandemic, this has led to an increase in opioid deaths in the past decade, an increase by 24.4% and an increase in overdoses by 38.6%. The public health learned that they need to get away from the previous approach and develop new strategies to help the growing opioid crisis. The Health and Human Services created a 5-point plan to focus on emphasized on science and utilizing evidence-based practice. This focused more on increasing access to addiction prevention, treatment, and recovery services. The other lesson that they learned was that the community needed more education on opioid use and overdoses, that the prevention was the key in assisting with the opioid epidemic, and that the community needed to, the public health learned that they needed to get away from the previous approach and develop new strategies to combat the growing opioid crisis. In response, the Human and Health Services created a 5-point plan that focused on science and utilized evidence-based practices, which focused on increasing access to addiction prevention, treatment, and recovery services. Another lesson that they learned was that they needed to increase education regarding opioid use and overdoses. Prevention is the key to opioid misuse, overdose, and death. Teaching the community about opioid addiction, knowing the signs and symptoms of overdose, and what they need to do if they witness an overdose is essential in lowering the opioid death rates and helping prevent opioid misuse.